Good evening and good to have you with us in this edition of the Urban Debate. Viewers, constantly here on Mirror Now, we've been bringing you the details of corona cases, the corona curve for the top 15 cities. Now, these 15 cities with the maximum number of cases have been extremely important in policy making and policy implementation to fight coronavirus. Now, why do I say that? This is because between these 15 cities, a large percentage of our coronavirus cases come, which means that if you leave these cities, the number of cases outside in other parts of the India are much lower. And so if we are able to get a grip on these big metros, on these big cities, then the path to beat coronavirus will become easier. This has also been the focus of our central government. This has also been the focus of our states. Lockdown phase 1, 2, 3, 4 has all seen specific focus on these cities. Now, if you are in one of these cities and you are wondering just how you have fared in the last few weeks in your battle against coronavirus, tonight we tell you that. In fact, Niti Aayog's Amitabh Kant regularly tracks the data from these cities, analyzes them and puts them out. He's put out an interesting set of tweets today and he's broken them into 3 separate categories. And over the next 1 hour, I am going to bring you these 3 categories of cities. That means, how is your city performing? Good, bad, almost on the good side, good news almost there, those kind of things. Let's begin with where we are seeing signs of good news. We are seeing some positivity and efforts bearing fruit. And on top of that list are 2 cities, Ahmedabad and Indore. Now, in Ahmedabad, viewers, the corona curve seems to be flattening. Slowly, gradually, these are early signs, but the corona curve seems to be flattening. The recovery rate in comparison to the rest of the country and other big cities is medium, though the concern here is the fatality rate. In Indore, remember, Indore was one of those cities that became a concern right in the beginning. Indore and Bhopal went into absolute lockdown and there was a strict clampdown in the initial days itself. There the corona curve is now flattening, though the recovery rate is high, but there is a problem with the fatality rate as well. The good news is that it seems that the worst may be over. You will have to see it over the next few days to judge that. Now, how are we doing this? What is the data that is being looked at? Extremely important to explain to you that data. And that's what I want to tell you right now. So this is what Amitabh Kant of Niti Aayog has tweeted. What he has done is, over a period of time since March to now, the number of daily fresh cases have been plotted on a map. But it's not directly the daily fresh cases. He's taken a median, a 5-day median, then taken that data point and charted that out. That's the curve that you're looking at. So effectively he says that if you take an average of fresh cases for 5 days and you chart that out, it gives you a better sense of the trend in terms of infection spreading. And in that trend, these are the 2 cities who may have already seen their worst. These are the 2 cities where the curve of corona cases is actually now flattening. So the number of new cases is gradually reducing. That's another way to look at it. Now remember, in Ahmedabad, they went extremely aggressive in terms of testing. That was one of the things that Ahmedabad authorities did. They also identified shopkeepers, vegetable vendors who come in contact with a large number of people on a daily basis. And they went into these crowded areas, they went in, and tested these vendors and identified the people who had been infected and isolated them. That aggressive strategy seems to be helping Ahmedabad at this point of time. The people there can begin to heave a sigh of relief but not let their guard down. Similarly, Indore saw the strictest of the rules and implementation right in the beginning. Huge amount of attention was given because in the initial days itself, there was a large number of cases that were getting reported from there. And you can see the benefits of a strict lockdown, the benefits of high level of testing even showing as far as Indore is concerned. But let's come to one of those cities that we've been constantly talking about, the city that still has a big task ahead of it. So now I'm going to go to category number 2. And category number 2 is of those cities that are actually still seeing the trend of increasing cases, which means the worst is not over for them, which means that they still have a tough task ahead, a long road ahead. And in this list of cities is Delhi and Hyderabad. Delhi has been on top of the chart since the beginning. It's a national capital. It has a high number of people living there. Density itself is high. And of course, the number of cases have been high as well. The point there is that we are not seeing any relief. So for Delhi, the corona curve shows an increase trend. The recovery rate is medium, which means it could get better. Number of people that are recovering needs to improve. The fatality rate though is low. So that's a good thing, which means lesser number of people are dying because of coronavirus in the city of Delhi. But viewers, this is a trend which is also indicative of what you're seeing in Delhi right now. Look at the way the government has become extremely strict with testing, is changing its testing norms. Look at the way the government has put out a fresh app. It has put out a fresh helpline number. It is now sending very, very stern messages to the hospitals and the private hospitals. It has asked the private hospitals to keep 20% of the beds dedicated for coronavirus patients. This shows that even the Delhi government is aware of the fact that they have a tough task at their hands. We have a guest joining us, an expert right now, to help us get some more insights into what's going on in Delhi and exactly what needs to be done. Dr. Mahesh Chandra Misra, former director of AIIMS, in fact, is with me. Good evening, Dr. Misra. Thank you for joining us. Dr. Misra, we are referring to these set of charts that have actually been put out by Mr. Amitabh Kant of Niti Aayog. And in the list of cities where they're still seeing an increasing trend, a rise in daily number of cases, is Delhi. Now, what do you think is the biggest challenge for Delhi?
I think the biggest challenge for Delhi is instead of reducing the number of testing, we have to increase exponentially the testing. Because if you remember from the beginning, even WHO was saying testing, testing, testing when our capacity was low. But over a period of 2 months, we have increased the government labs as well as private labs. But I am told that in Delhi, the Delhi government has barred or banned the private labs conducting these tests. So it's a baffling thing why the testing should be banned at this point of time when we need its most. I think that is something will tell us, and also it will give us the sense that where we need to put our resources more than less. And that is something which so far Delhi government has done well, the way it has been managed. But somehow in past 2-3 days it seems they have when they have banned the private labs for conducting these tests, because government labs have a long waiting list. They have a long waiting time even to go and to seek lab. We are getting messages that people are going from lab to lab, Ambedkar Hospital, then Koi Maharaja Agrasen Hospital, then here and there, and still the time for testing is given after 2 days, 3 days for symptomatic patients. Now, if these patients, they go and mix up anywhere, they stand in queue, people around are at very high risk. These are, some of them may be super spreaders, as we heard yesterday from ICMR study that there is a small number of patients who are super spreaders. So we need to very rapidly identify these super spreaders and contain them in their homes or in hospital, depending on the condition of these patients. So I think instead of reducing the number of testing, and the reason given was in few hospitals was like Ambedkar and other hospitals in West Delhi was that they are exhausted with the kits. So somebody went across in 3 hospitals, stood in queue for a long time, and to be told that you come after 3 days for testing. Now, if this is the way, then naturally it's a recipe for disaster in coming week.
Mirror Now investigation.
सर कोविड पेशेंट के लिए कितना एडमिशन चार्जेस है आपके यहाँ?
कि अगर वार्ड में होगा तो 3 लाख और जो आईसीयू वगैरह में अगर पेशेंट जाता है तो 5।
After Chennai, now Delhi reality check. The steep COVID cost burden. Find out how much you may have to pay.
एडमिशन के लिए आप आएंगे तो ऑन दैट टाइम आपको इनिशियल डिपॉजिट जो है वो 5 लाख रुपीस डिपॉजिट कराना होगा.
So clearly the stages of struggle that public have to face if the person in your family found to be corona positive.
First of all, I would like to thank Mirror Now and your journalists. I'll take it up with the government. It's not a time to make money.
All of us have sacrificed something in order to support, and I think the private hospital should put up with a small amount of loss rather than look at profit.
During this pandemic time, why can't the hospitals have a cap on the total pricing?
Various organizations who are running these hospitals, who actually got many of these hospital buildings and that land at a very low cost, start looting us and fleecing us. And if that's what's happening on ground, and if they're not going to be transparent about why they are demanding so much of money from us for COVID treatment, then there has to be account from these hospitals. We hope that happens.
Mirror Now investigation brings out the reality. Relentless campaign on medical preparedness. Series of ground checks in India's big cities. Shortage of beds, busy helplines, expensive ambulances.
कोविड पेशेंट के लिए बेड चाहिए था.
कोविड पेशेंट के लिए मैडम अभी तो बेड अवेलेबल नहीं है अपने पास.
Critical patient emergency can happen anytime. So what does the hospital do in such cases? At that point in time also we got the same standard response that we have no bed, maximum 5 to 6 days, nothing can be assured and promised.
आपके द्वारा डायल किया गया नंबर अभी व्यस्त है. कृपया कुछ समय पश्चात प्रयास करें.
You can clearly get a sense that those people who are completely on distress and they want to reach to the hospital, how much problem they would be facing.
ICU बेड चाहिए था. प्लीज कैंटीन में अवेलेबल होगा क्या? मैम ICU बेड तो सारे फुल है. PMC chief assured Mumbaikars that as far as Mumbai's health infrastructure is concerned, there will be no shortage of any type. As far as the ground reality is concerned, that is far from those claims.
बेड्स अवेलेबल नहीं क्योंकि संख्या ज्यादा है और इसीलिए हम नए अस्पताल तैयार कर रहे हैं. 10,000 बेड की व्यवस्था कर रहे हैं.
Mirror Now brings out the reality. From handling the migrants' mess.
And the migration of the people from one area to other area is the biggest challenge.
मैं मजदूरों को यहीं पर रोजगार उपलब्ध कराएं. पूरी तरीके से तैयारी कर रहा हूं.
To creating health infrastructure.
हरिद्वार जनपद 2,500 लोगों की स्क्रीनिंग पर डे कर सकते हैं.
कोविड फ्री टूरिज्म आगे बढ़ाने के लिए हमारी भी सेपरेट से SOP डिसाइड रहेगी.
And reviving the economy.
There will be a series of announcements as time, and we will ramp it up.
70% से ज्यादा हमारे रोड कॉन्ट्रैक्ट के काम शुरू हो गए.
Safety can be put as a priority for the tourist. I'm sure we can convert this crisis into an opportunity.
Mirror Now questions the decision makers.
Everybody knows MSME is the biggest concern right now.
Every state is given that financial headroom to fight this battle.
Rural area, we don't think there is any issue.
Hear the voices that matter on war against coronavirus.
जो कोरोना का संक्रमण है उसको कम करना तो ये बहुत बड़ी चुनौती है.
Mirror Now, you first.
My apologies for that. Bit of a technical issue, always there possible, especially when we are working from home in times of a pandemic. But I'm back now. My apologies also to Dr. Misra. Dr. Misra, the question that I was asking you is how important testing becomes to know a clear pattern. But the big concern, Dr. Misra, will also be that we are opening up our cities now. Now, is there a fear that if there are more cases and we are testing less, then maybe we shouldn't be so quick in opening up and allowing more interaction amongst people?
The opening up will be needed. Now, we have seen the problems of lockdown, economic problems with a lot of people, every section of society. So we cannot have the lockdown for long period of time. What we can do and what we should be doing, and we are doing in some ways, that these super spreaders in hot zones or hot spots in red zones need to be identified, and the only way to identify these people is by testing, more testing. Now, if there is a ICMR study which has come out, and in which they have said there is only 7% of patients who are super spreaders. Rest of them might infect one individual or two individuals. So I think if we don't do testing, and the other advantage of testing is that in some areas you have done testing on those who are found to be negative, you can allow them to move around and go for their work. So I think testing, there is no replacement of enhancement of the testing, but what we have been seeing for last 2-3 days, that the private labs have been banned in Delhi from conducting the RT-PCR test, and government facilities have limited capacity. We are getting messages that people are going from Delhi government hospital to hospital, and they are being told that our kits have exhausted, we cannot do the test, come after tomorrow, day after tomorrow, after 3 days, they are being given appointments. People wait for hours, and if you can imagine, if symptomatic people wait in OPDs or for testing also, they can spread easily people around them, and these were symptomatic people. So after that, the patient returned to home without having got the testing done. So this is something, and he said, I could have done it in private lab, but the private labs are saying we cannot do because Delhi government has banned them. So I think if we are limiting the testing, and that's how we are reducing the number of positives, I think that's something we are asking for, a recipe for disaster in coming times. I think that should never be done. Regarding again the availability of the bed, the application which has been put up, it's a good idea, but then it should have been very well rehearsed, and also it has to be linked with a call center where there are multiple lines and people can get response from the call center. Actually, rather than I am ringing up a hospital to find out a bed, I think it is people should call the call center, and they should have the dashboard saying which hospital has how many beds and where this patient can be directed. And it should be, the call center should be linked to all the hospitals, government hospitals, private hospitals, because it may so happen that government hospitals might be running to their full capacity. They may not be having bed, but since the Delhi government has issued a circular saying that 20% beds in each hospital having 50 or more beds will reserve for COVID, so they can be guided there. Now the question comes up, who is going to pay for this treatment? Now the Delhi government also may assure the nursing homes, the small hospitals, because the hospitals are also in big trouble over last 3 months. Their revenues have dipped, they have no money to pay out salaries, and on top of it, if you ask them to give free treatment, where is the money with them? And they are not able to pay their employees and the doctors, the nurses, the cleaning staff, the hospital staff, support staff. So I think they have to give out support to these small hospitals, because they are already in deep trouble. So I think that the government is losing sight on this aspect and not paying attention, and they are saying the testing is reduced. So that's way you can reduce the number of positives. And with unlocking, naturally we are going to have more people where there is no symptoms or they are pre-symptomatic moving around, and maybe some of them may be giving infection to others. So if testing is done and somebody has been found negative, I think that will be very reassuring for that individual. Also, it will help in containing the disease.
Okay. Well, I'm going to thank you, Dr. Misra, so much for joining us. Delhi does have a few big problems. The fact of the matter also is that even the app that was launched, and this was the investigation that Mirror Now did today, the app shows you beds are available, beds with ventilators are available in XYZ hospitals. But when we called up those hospitals said, no, there are no beds available. Now, either the hospitals are not giving us the truth, or there is a data mismatch and absolutely no communication between the two. We have have been told that this app is supposed to get updated twice in a day. Well, if it is going to get updated twice in a day, then why should be there any data mismatch? What are the people supposed to do? Go from one hospital to the other in the lookout for a bed? These are the things the government needs to look at. Ramp up the testing. Keep a track of what private hospitals are doing. Give more access. Add the number of beds. Add number of ventilators, oxygen cylinders, and ensure that whatever norms have still been to be followed are actually followed. Lockdown violations, viewers, is something that will put us back. That will put us a step back in our battle against coronavirus. Let's move on to the next city. And I'm going to talk about Hyderabad and Chennai now. Two cities which are also a bit of a concern. And that is because these cities themselves, the cases are still on the rise. There is an increasing trend. Just like Delhi, Hyderabad and Chennai are also cities that are a bit of a problem right now. So let's say good evening to Dr. Guhanandam, public health expert and former city health officer in Chennai, joining us this evening, and Dr. Sanjeev Singh Yadav, secretary for IMA in Telangana, who's also joining us right now. Dr. Yadav, let's begin with you. Because there's been quite a bit of controversy when it comes to Telangana. There are questions that are raised of whether enough testing is being done even in the city of Hyderabad, that there are very limited centers, private hospitals have not been roped in. Where do you think Hyderabad is struggling and why we are still seeing a rise in cases?
This issue in Hyderabad is there are few testing centers which are only there with the government of Telangana. They are having some hospitals. The High Court has given orders for the private people to start testing, but for reasons unknown to us, the government has not given permission to them to start. In Hyderabad, maybe most probably 900 to 1000 can be tested per day, as per my calculation. So the issue is this. And other thing is, in Hyderabad, the problem is many people are going to many private hospitals where there is no direction on how to get this testing done and how to get this issue done. Although 104 and 108 are given concerns about where to go, but still the testing is limited. Only 800 to 900 or 1000 can be tested a day. That issue becomes more, especially when the lockdown has been lifted. And there are a lot of migrants returning to Hyderabad. That is one more reason why the positives are coming more. Especially with the doctor community, this issue is more because we cannot say that we will not treat a patient. We are treating the patient. The quality of PPEs given earlier was bad, now it is good. But it is only given to COVID centers like Gandhi and other hospitals. Now the new hospitals are facing problem regarding this mask and N95 mask and kits and all. That is the reason why the higher number of positives are coming in Hyderabad.
I also want to tell our viewers that in Hyderabad, actually, it started off much later. The number of cases began to rise. It contributes roughly to about 1%, 0.85% of the country's cases, but it has a biggest contribution to the state of Telangana. It contributes almost 66% of Telangana's cases are coming just from Hyderabad. So imagine that, viewers. This is why these cities are important, because the distribution of cases, the case load is so high in these cities, and outside of that, the rest of the country is also having to face a shutdown or restrictions because of it. Now, Dr. Yadav, the fact of the matter also is that Telangana is one state and one government where they continuously, they're the first ones to extend the lockdown. They're the first ones to clamp down, put restrictions. Is there a growing sense now that without building the infrastructure and enabling the hospitals, our solution is only to just lock people indoors?
No, ma'am. Lockdown was a good effective measure which was given. Especially the way the lockdown was broken down is one thing which is a big of concern. The areas with containment zone, people have been come out of the lockdown area, and this is a reason for spread. Especially the migrant issue is one other reason why the spread has become more prominent. And this spread has been affecting the medical community. The postgraduates, the resident doctors, these are the ones which are maximally affected because of this increasing number of patients coming to limited hospital spaces. Although a big infrastructure has been created in Gachibowli, Telangana Institute of Medical Sciences, but still it is lacking in some effort which should have been doubled as per my calculation.
Okay, let me also bring in Dr. Guhanandam. As well, we bring in the city of Chennai as well. Viewers, Chennai is one place where suddenly we saw a burst in cases few weeks ago, and that is still continuing. Every time we've spoken about Chennai, we've talked about how there was a lot of laxity in implementing the lockdown. There were a lot of lockdown violations that emerged, markets which were open, people who were allowed to freely roam. And by the time we got our acts together and started tracking all of that, Chennai was reporting 700, 800 cases on a daily basis. It's reached a 17,000 number now. When coronavirus hit us, by end of March, Chennai was nowhere in the picture. What's happened, Dr. Guhanandam? Is it failure to implement the lockdown, or the fact that we didn't do enough testing in isolation? Where did Chennai go wrong?
Good evening. This is wonderful to listen from you. Chennai is actually doing a very good work, and for the state of Tamil Nadu and as well as in Chennai, the public health system is so strong that we are identifying more number of cases. The number of cases are being increased because our testing rate is also increased. You can understand, among all the metropolitan cities in India, Chennai city is testing large number of people. We are interested identifying the cases, testing them, and then putting them on quarantine and treatment is our ambition. And I have seen about at least 5-6 epidemics. Out of them, 3 are pandemics. I really want to tell our people that here the positivity among the younger generation and the middle age group is more, and it is also identified among the elderly people and the youngsters. But the number of cases are positive, which is recording more than 800 or 1,000. They are only from the middle age group, and middle age group are only recording cases of positivity. So I want to tell you that positivity is only the virus infection found in the people, not the disease. Once it is found out to be positive in the RT-PCR, there is time for them to develop as a disease. Most of them who don't suffer from comorbid conditions like diabetes or hypertension or cardiac illness or tuberculosis, they don't suffer disease. So we are interested in identifying more number of the elderly people who suffer from comorbid. So Chennai Corporation, with the support of the government and the very good public health system of doctors and the paramedicals, we are going house to house identifying people suffering from comorbid conditions, that is NCD, and we are picking up them for testing. All those who are tested to be positive, their contacts are being tested. So because we are increasing the testing rate, the number of positives are also found to be high. But if you see the deaths in Tamil Nadu as well as in Chennai, it always
Dr. Guhanandam, what is the testing rate right now, and how many tests have been conducted in the state so far?
In Tamil Nadu, the testing was gone more than about 6 lakhs. And in Tamil Nadu, in Chennai alone, the testing rate is about, we have crossed about 2 lakh testing in Chennai alone. And the testing rate is quite high in Chennai. The testing found to be positive among the younger.
Mumbai, for example, also is doing a similar level of testing, but Mumbai is not showing an increasing trend. Mumbai, in fact, it shows that it's way over its peak now, which is why I'm asking you a question. Yes, testing becomes a data point to talk about, but that may not be the only reason, Dr. Guhanandam. Mumbai has tested over 2 lakh samples by now. It has one of the highest testing rates in the country, and we are on a decline here. But Chennai isn't.
Chennai, there is another issue. We have zones like 4, 5 and 6 zones where the labor population is quite high, the slum population is quite high. The curfew, as you said earlier, the people were not able to adhere to the curfew, as you earlier mentioned. That could be one of the reasons. But in spite of seeing more number of positive cases, the death is always less in Chennai. So that is the epidemic trend. That's a crucial point of an epidemic. We are doing all these activities to identify more number of positive, to quarantine them so that it doesn't affect the elderly people, so that the deaths could be avoided. And our hospitals are very well strengthened. the system is also strengthened with the manpower and the logistics. So we will be seeing a declining trend very shortly because we are increasing the testing rate in Chennai. And we are also
okay. Because you're talking about it, let me see if I can go back to Dr. Sanjeev Singh Yadav. Dr. Sanjeev Singh Yadav, please tell me if I am wrong here. But Telangana is one of those states that doesn't even update its numbers on a regular basis. We've tried to map it out. It's been a task, which is why I'm going with what the center is telling us, and that for Hyderabad the numbers are on the rise. But Telangana had tested, and this is the data that was released on 16th of May. 23,000 tests were done, 23,388 to be precise, as of 16th of May. If I go further back, as of 29th of April, 19,278 tests was done. This looks like, Dr. Yadav, that we did only 4,110 tests. 4,110 tests over 17 days. That is shockingly low. That's just 240 tests every day.
The issue is the Director of Public Health is giving daily notification regarding the number of positives and the number of treated cases, number of deaths. As the Chennai doctor told, the deaths here in Hyderabad are not that much. The only issue is you are asking about the testing numbers, but the testing numbers, I think they are not correctly represented. The director is giving out every detail every day, but this calculation, somewhere there is some link missing, wherein almost, if my information is right, 800 to 1,000 tests are done every day in Telangana. We have around 7 centers. The only other issue is private sector people have to be involved, and that will come in good times, because we are in touch with the health ministry. We ask them to see that the private labs are allowed to give testing. I think it is a question of time. In few days, this thing will also start. I don't think there is any mismatch regarding this particular thing. I don't think you have a correct data on that particular thing.
It has one
Every
of the
day,
lowest testing rates across the country. I'm just telling you on comparison to what the rest of the country is doing. Telangana is testing even less than Chhattisgarh right now, doctor.
But if you compare it to Uttar Pradesh and other places where the population is more, Telangana testing is on par. Although you feel it is less, but our centers are only 6. We can do around 50 each. So it will come around to 800 to 1,000 tests a day. That is the reason why. Other thing is, we are only doing rapid tests.
Yes,
Others are doing.
So what is the government? That's exactly my point. Won't you agree then that the government by now should have actually stepped up on this and added more testing centers, added more hospitals, more beds? You can't keep the testing so low and still see such high numbers. A data assessment by the central government, and now Telangana government may refute it if it wants, said that between 26 May and 1st June, Telangana's test positivity rate was 20%, which is second only to Delhi. And that in that 1 week, between 26 May and 1st June, Telangana only conducted 4,300 tests. Now, Dr. Yadav, that is, I think that would be a concern, especially for a city like Hyderabad, which is so crowded.
It is only the GHMC or the Hyderabad areas which is having a problem in the positivity rates. Rest of the Telangana is doing quite very reasonably well. I will go with you that other private centers must be allowed to test. But all said and done, the government is contemplating on giving license to them to start the testing. They are ready for the testing, and they are trying to increase the other centers in and around Hyderabad so that the testing rates increase. I agree with you, but the thing is, your calculation somehow doesn't match to my calculation, where only 4,000 something. And as for me, every day 800 to 900 tests are being done every day. That is my calculation, which is going on. I think if you give me some time, I can come back with to you with the correct numbers. Yeah.
No, you may be right. I am quoting the data that has been put out by the center, but at the end of the day, fact of the matter is that, Hyderabad as a city is a big concern, and you are right. The problem is not outside of Hyderabad, in the rest of the state, because if you see, Hyderabad itself contributes to 66% of Telangana's cases. So all the problem really lies in this one big metro city. If we get this right, Telangana's more than half the battle will already be done. This is as far as Chennai and Hyderabad is concerned.
I'm hearing you. Please tell me.
Yes. I just want to also... Sorry, go ahead, please.
Hello. Hello.
Yes, Dr. Yadav, did you want to make a point?
No, ma'am, I'm not. I think the point is Hyderabad is a cosmopolitan sector wherein because of this recent trend of getting people from everywhere has started, people come to Hyderabad. There are a lot of IT sector people here, a lot of laborers who are working from Bihar, Rajasthan, Gujarat and other places. This adds up to the number of positives. It is not the local population per se. It is the migrant population which is creating more positivity in Hyderabad, and that is spreading. And one more thing, the old city, which is a very densely populated area, because of the lockdown being opened up, that is one of the reason why this positivity rate is increasing. Otherwise, I don't think there's much of an issue. The death rate is very, very low in Hyderabad compared to other places. And the positive status, the treatment given, the other private hospitals are also allowed to give the treatment. But testing is one thing which is not being done. That is the only thing which I will add to. Hello.
Yes, yes, I understand what you're saying. Very quickly also, if I can just go across to Dr. Guhanandam. Dr. Guhanandam, very quickly, what do you think should be the priority even to deal with the city of Chennai? Let's assume that, you know, this the data that has been put out by the central government, by Niti Aayog's Amitabh Kant, and he says that in terms of increasing trend, there are cities of Delhi, Hyderabad and Chennai, where obviously the worst has not been hit yet. So to ensure that we reach that point quickly, what should be the priority?
The priority, for example, Tamil Nadu is really crossing about 5.6 lakhs tests. Every day 15 to 17,000 tests are being done.
Yes.
In Chennai, it's 4,000, 5,000 tests. But we are interested for focusing on the vulnerable groups which may cause deaths. Our point is reducing the deaths among the elderly who have got comorbid conditions, because that's the reason why we are going for search in the individual houses with more than about 5,000 grassroots level workers, paramedical workers, and we got all our 3-4 medical colleges in the city fully equipped for handling these patients. So handling these comorbid elderly people above 50 or 60 years is our priority. And more than this, large number of people who have come from Mumbai, Gujarat and Delhi and the other flights which are coming to Chennai, this is also contributing more number of cases. So our priority will be testing the vulnerables, number 1, identifying their contacts, number 2, number 3, treating them for their own comorbid conditions so that they don't succumb to death. This is our priority. So identifying in epidemiological approach, identifying more number of positive cases is the beginning stage of our success story, because you are going to identify more number of positive cases, more quarantine could be done, more spread could be avoided, and the epidemic could be stopped. So at this rate, I think in another 2-3 weeks, we can bring in a declining trend in Chennai as well as Tamil Nadu, because our deaths are always very well controlled, which is the success story of an epidemic control. So Chennai is equipping itself both by taking care of the poor people, slum people, middle income group people, and also the affluent. The testing centers are about 41 centers in this state, and we have in Chennai also we have got lot of testing centers, and it is made very much easy. And we are also giving lot of inputs for psychosocial aspects of the people who are suffering at home because of the quarantine.
Okay, all right. Thank you so much to both of you for joining us. Our experts from different cities joining us, giving us their view on how they see the city's performance and the way forward. Let me quickly recap this to you, viewers, as we tell you how your city is faring in the battle against coronavirus. This is the data that has been put out by Amitabh Kant of Niti Aayog, and he's constantly be tracking the top 15 cities, and he constantly puts out data from these 15 cities, which are the largest contributors to coronavirus cases, like in terms of case load. The good news comes from cities like Indore and Ahmedabad, with a word of caution that these are just early signs. We have to see how they continue to tackle the number of cases and reduce them. But yes, there the coronavirus curve seems to be flattening. The 3 cities which are still the biggest concerns are Chennai, Hyderabad and Delhi. In Delhi and Hyderabad, even the positivity rate is also high, which means every 100 people that are being tested, in Delhi over 25 people are coming out as positive. In Hyderabad, over 20 people out of 100 are actually testing positive. That's concerning, and that needs some specific attention. It also needs building up of healthcare infrastructure. It also means bringing in more private hospitals, and enabling all kinds of support to the healthcare professionals, and ensuring that we still maintain social distancing even as we open up our cities. Now, let's go to the big one. Two cities that have begun to show the turnaround. Two cities that have begun to show a decline in number of cases, a decreasing trend. And when I say decline in number of cases, I don't mean suddenly the total number of cases have come down. What I mean is that as per the data that has been put out by Niti Aayog's Amitabh Kant, the 5-day median of fresh cases, every day there are fresh cases which are reported. If you average the last 5 days and then you plot that out, you're beginning to see a decrease in cases. Basically, the worst may be behind us. Too soon to tell. Early days, this trend could turn around tomorrow itself if we let our guard down. But this is what it looks like for Mumbai and Pune. Now remember, even as a large part of our country today is seen wide set of relaxations come in Mumbai and Pune, the government has been very, very careful in lifting the restrictions because it's tricky. Let me bring in an expert. Neeraj Hatekar is joining us this evening. Mr. Hatekar, in fact, has been very closely tracking all the data points and seeing how, the curve has moved for both Mumbai and Pune. So let me ask him what his view and his own analysis shows. Mr. Hatekar?
Yeah, so thank you for having me here. I think first I would like to state that let's not go too much by what's happening in the last 3-4 days in Mumbai, because Mumbai had a cyclone last 2-3 days and not too many people went out for testing. So the dropping numbers in the last 4-5 days might not be very much of an indicator. But having said that, I would like to point out that Mumbai's doubling period has been consistently increasing. It's around 15.7 now, and we also regularly track its R, so its R also been consistently falling. Interestingly, if you look at the average R and average doubling period for the state, then Mumbai actually has a lower R and a lower doubling period compared to a lot of other districts in the state. It's actually lower than average. So basically, Mumbai is now slowly being establishing control. The problem is its large size, because you see you are working on a base of something like 46,000 cases. So even if you just grow at 1%, you're going to have a large number of cases which are going to seem very big, and therefore it is this large number in the Mumbai which is attracting a lot of attention. But if you look at its R, its doubling period, in fact its R and doubling period are now both lower than that of Kerala, which is at the moment, because Kerala has seen a drop in its doubling period. So Mumbai is not doing that badly from a dynamic situation. What we need to worry about now is, I think, increasingly, what's happening in other districts, because people from Mumbai have gone away to other districts, and it's really going to be how we're going to look at the epidemic in the other parts of the state where, the districts where migrants have moved away. But I think Mumbai definitely is establishing slow control. Its size is very big. The numbers are very large, and therefore the new cases will keep on coming up. But let's not only pay attention to that, let's not that distract us too much.
Well, the one good part about Mumbai data as per the center is that the fatality, the recovery rate, though low, is improving. And the corona curve is declining. But let me ask you, as per your own analysis, and obviously this can change any day, had the cyclone hit us in a worse manner, we would have probably had a bigger problem at our hands. Right now we got safe from that. But Mr. Hatekar, when do you think the cases for Mumbai could peak and then actually show a larger turnaround?
You see, I don't know whether there exists a peak at all, because we don't know how much the curve has been flattened. So we don't really know whether it's going to be a peak or there's just going to be a flat top for quite some time. So let's not talk about a peak. But my reading is, because we have a very large base in Mumbai, we have something like around more than 40,000 cases. So even if our growth rate now currently is 3.5%, if it drops to even 1%, you're still going to have 400, 500 cases coming up. But the curve has already flattened. We are growing much slowly. Our doubling rate has already increased substantially. It's more than it's more than the average for the state. Our R, which we calculate every day, is lower than the average for the state. So Mumbai has actually not done very badly. Mumbai has shown signs of improvement for quite some time.
Okay, so Mumbai is showing signs of improvement for quite some time. I just want to also point out that as far as the overall picture is concerned, and why we keep talking about these big cities is their contribution to, the overall country's case numbers. Mumbai, viewers, contributes almost 20% of India's cases. Almost 20% of India's cases actually come from the city of Mumbai. For the state of Maharashtra, its contribution actually is 57%. 57.37%, which is why if this is a battle that we are able to win, and this is a city where we are able to show a turnaround, it will make such a big impact to the entire country. But Mr. Hatekar, what do you think will be our biggest challenge right now? As per the government's data itself, civic bodies data itself, our ICU beds are full. Our general beds are up to 80% of their capacity. Our ventilator and oxygenated beds are also completely full. We are now looking at setting up field hospitals. Is there a concern on the health infrastructure just because of the sheer size and number of people in this city?
Absolutely. You see, if you look at municipal wards in the country, if you look at the 100 most crowded wards, 40 of them are in Mumbai, all over the country. You see, so Mumbai is a very densely populated city. And if you look at the wards which have the large, so for example, our Dharavi has more than 2,000 cases, which is more than what Kerala as a whole state or Punjab has, right? So we're going to have huge numbers. And clearly our health infrastructure is not equipped to deal with those kinds of numbers. So the primary challenge really is not how fast Corona is spreading. Primary challenge is whether our, the constraints on the health infrastructure. And that really is the primary constraint that's the primary concern that all of us are to have, because we're simply not going to have enough ventilators or enough beds, so that is the challenge.
Oh yes, absolutely. I just also want to point out that one city that was also a big concern earlier but now is beginning to show a turnaround is Pune. And just like Mumbai, Pune has also seen a strict set of restrictions. The relaxations haven't been that far-reaching as some of the other cities and states. Pune contributes to roughly about 11.3% of the Maharashtra's cases. Obviously, the national contribution is about just 4%, so it's lower. But it's still, in terms of cases right there, though it's beginning to show a turnaround. The key lesson here, viewers, is the cities like Ahmedabad, Mumbai, Pune, that have shown strict implementation of the lockdown rules have actually benefited from that, with high number of testing, with an aggressive testing and tracking policy. The cities where initially we saw some laxity, and even there was a lockdown announced, but the laxity in testing and policy implementation are the ones where there is still a problem. Delhi as a case continues to be a challenge, where the government says they have the health infrastructure ready and they're ready to open up. But unfortunately, what we are seeing is a high positivity rate. Imagine a positivity rate of over 25%, which means that there may be more people there who have the infection who haven't been tested so far. So these are the cities who cannot let their guard down. All these 15 cities, Mumbai, Chennai, Ahmedabad, Thane, Pune, Indore, Kolkata. By the way, Kolkata is the other big concern, and of course Cyclone Ampan, the way it hit that city and the state has just put them 4 steps back in their war against Corona, and the challenge has become bigger. But Kolkata was already lagging behind, and that continues to be the other big focus. And so we will get you those details another day on another edition of the Urban Debate. Surat, Hyderabad, Aurangabad, Jodhpur, Bhopal, and interestingly, Chengalpattu from Tamil Nadu has actually now made it to the top 15 cities. Some are showing great amount of improvement, others are lagging behind. We'll keep a close track. Thank you so much for joining us on this special edition of the Urban Debate. Viewers, a video that is doing the rounds has now gone viral, shows BJP leader Sonali Phogat, a TikTok star, now a politician, slapping, repeatedly thrashing a government official with her chappal. Now, this video was actually also tweeted by the Congress leader Randeep Surjewala, questioning Mr. ML Khattar of Haryana what's going on. Now, in the video, you can see her constantly again and again slapping him. She is also yelling at him and saying, how dare you talk to me like this? How can you use such objectionable language? You think I'm going to take it just because I'm out here doing my work? So she's obviously upset about what has been said to her by this government official. We spoke to Sonali Phogat. This was her clarification.
आप लोगों के सामने नहीं आना चाह रही थी, लेकिन आज अगर मैं नहीं बोलती हूँ तो ये मेरे खाली एक महिला का सवाल नहीं है, ये जो भी कामकाजी महिला है उन सब का सवाल है। अगर कोई पुरुष उसके बारे में गंदी भद्दी टिप्पणी करता है तो मुझसे तो बर्दाश्त नहीं होता। उन्होंने कृष्णा गहलोत के बारे में बोला, पहले कमलेश ढांडा के बारे में बोला, और उन्होंने ऐसा बोला कि वो जाट महिलाएं होते हुए ऐसे हांडती रहती है। तो सोनाली जी, आपको इतनी खूबसूरत, तो आपको क्या ज़रूरत है ये मंडी में धक्के खाने की, इनके किसानों के बीच घूमने की? आपको सारी सुविधाएं घर पे ही मिल जाएंगी। इस तरह की चीज़ें जो मतलब मैं ये एक बात बताई मैंने आपको, मैं सारी बातें आपको नहीं कह सकती, बस इसी बात में आप समझ जाओ मुझसे बर्दाश्त नहीं हुआ, और कोई भी महिला होगी वो कोई बर्दाश्त नहीं करेगी ऐसी बातों को।
Samya is joining me with more on this story. Samya, we heard what her justification is, but the Congress party obviously using this as a tactic and playing up the story.
One thing is very clear, no matter who the leader may be, no one is above law, and we are not here to judge whether who is saying the truth. It begs an investigation to ascertain which side of the story is believable. We are not here to condemn the fact that why did Sonali raise that particular slipper at that officer, because if she felt the need to, because if he was saying anything provocative, that may have been the reason. But the fact remains that any bureaucrat who is on duty calls, who is carrying out his responsibility as the market committee secretary, cannot be thrashed, assaulted or brutalized in broad daylight by any private entity during his duty calls. This is definitely criminal, and that is exactly what is the question that the Congress leaders have been raising, that the bureaucrats, the babus, the officers do not feel safe under the Khattar government because their dignity and their safety is not factored in, especially when there are BJP leaders like Sonali Phogat who get away with impunity. Why has there not been any disciplinary action taken so far by the BJP government of Khattar government so far? Because let's say if he did say something objectionable, there was a forum to address that. There was a protocol that can be followed. He could have been suspended or extricated from his position. But the fact remains that why did Sonali try to take law into her own hands? Why did she lift that chappal, that slipper in her hand and thrash that particular market committee secretary in broad daylight? And those visuals speak for itself.
Correct.
We are not here to say that Sonali may not have a reason to raise an objection, but can she take law into her own hands? It's a larger question that we are asking over here.
All right, Samya, thanks so much for joining us on this story.